The first thing to understand about back pain, it is one of the leading causes of people reporting pain in the US and one of the leading causes that people miss work in the United States. So it's quite an important thing to talk about. There's different kinds of back pain and they all come from different things. So muscle strain, arthritis, structural issues, and then bulging or herniated discs. Muscle strains are pretty much injuries that occur after repeated movements and or lifting improperly. Those twisting movements that you kind of go back and forth to get the laundry out, that can cause a muscle strain. Or if you're at work and you're lifting something heavy overhead or just lifting in general and don't have good back support or strength in your core, that will also cause muscle strains. Osteoarthritis in the spine. There are different areas where arthritis can affect the spine. The first one would be narrowing of the passageways where the nerves go. Here's your spinal cord in the middle, deep within there, and these are the things that stick out in your back. These are the nerves that come out through each level. So if there's narrowing of the canals where the nerves come through, that's due to osteoarthritic changes. In addition to the areas there, also you can have osteoarthritic changes as the disc material here gets thinner. So each disc between each level of vertebrae here between the bones has a certain thickness to it. And over time, as we get older, that thickness kind of thins out. So this bone then gets closer to this bone, and then this bone starts rubbing on this bone, and that's arthritic changes as well. You can also have excess bone formation in any of these areas that impede the space. So if there's no thinning of the disc and or there's no narrowing of the canal here, you can also have excess pieces of bone impeding in the space where the nerve goes through, which then touches the nerve and causes pain. Bulging and herniated discs. There's pain that is sometimes in the back and also in the legs. Usually when there's a herniated disc, the pain is actually below the level of the knee. So that's one way to tell the difference between just regular back pain and something involving the discs. A bulging disc incorporates the outer layer of the disc material coming out from the middle of the space. A herniated disc involves the central portion of the disc actually protruding out, which is much more severe, causes a lot more compression. Then as the compression continues to get worse, you then not just have pain, but you also have numbness, tingling, and weakness that may occur into the legs. So the biggest thing to note is muscle strains usually stay up in the back area. You can palpate the muscle, kind of feel where the soreness is. There's no real radiation of symptoms around the leg area at all. Bulging and herniated discs more so involve compression of the nerves, and because there's compression of the nerves, that's why you would feel pain going into the legs. The other thing that can happen structurally is scoliosis. Scoliosis is something that most people figure out they have when they're younger, and if they don't figure out they have when they're younger, they start to figure it out later because they're starting to have pain. Scoliosis is the curvature of the spine, and then you have muscles that are on one side of the curve that are really overstretched, and then on the opposite side of the curve is where the muscles get super tight. How does physical therapy help? Physical therapy helps a ton when it comes to back issues. Most of the time, patients can get help immediately and should seek help immediately when they have back pain, because even if you wait and see, and yes, it does get better, we can actually help it get better a lot quicker. Costly tests, X-rays, MRIs especially, will indicate things that we can actually tell you about on your evaluation, and you wouldn't need to spend all that money to go get the MRI. The MRI kind of just gives you somewhat of a diagnosis or picture as to what's going on inside, but even in an evaluation with a physical therapist, based on your subjective history and what you present like, we can actually be able to tell you those things without the costly MRI. If you go and get one of these tests, especially an X-ray, past a certain age, you're pretty much going to find something going on anyway, but is that really the source of your pain? We can actually figure out what the cause of your pain is, and getting an MRI or an X-ray is just more time that's taken in trying to find out answers that we can give you immediately when you come in for your evaluation. So if you're interested in learning more about back pain and how we can help you, you can call the number below or click the link below.